Hello, everyone. It's Friday, February the 12th. Am I kind of echoing a little bit? Keep going, they say. Okay. Well, I tell you, it's still not great news by any stretch of the imagination. We lost 25 more West Virginians since Wednesday, but that number is dramatically different and absolutely lower, and you'll see as we go forward, you'll see a lot of numbers that are getting better and better in West Virginia. Out of all respect, I am honored to call these people and their gender and the county that they lived in and their age. So our 21st 176th death is a 68-year-old female from Marion County. Our 21st 177th death is a 68-year-old male from Marion County. Our 21st 178th death is a 67-year-old male from Hancock County. Our 21st 179th death, a 75-year-old male from Harrison County. Our 21st 180th death, a 75-year-old female from Hardy County. Our 21st 181st death is a 75-year-old female from Hardy County. It is an additional death. It is two the same age in the same county. Two beautiful women that we've lost. Our 21st 182nd death is a 92-year-old female from Ohio County. Our 21st 183rd death is a 78-year-old male from Morgan County. Our 21st 184th death is a 73-year-old male from Roane County. Our 21st 185th death is a 50-year-old male from Cabell County. Our 21st 186th death, an 88-year-old male from Berkeley County. Our 21st 187th death is an 89-year-old female from Summers County. Well, our 21st 188th death is a 93-year-old male from Fayette County. Our 21st 189th death is a 98-year-old female from Harrison County. Our 21st 190th death is an 82-year-old male from Berkeley County. Our 21st 191st death is a 52-year-old male from Berkeley County. Our 21st 192nd death is a 75-year-old female from Greenbrier County. Our 21st 193rd death is an 82-year-old female from Harrison County. Our 21st 194th death is a 77-year-old male from Kanawha County. Our 21st 195th death, a 45-year-old male from Kanawha County. Our 21st 196th death is a 93-year-old female from Mercer County. Our 21st 197th death is a 68-year-old female from Kanawha County. Our 21st 198th death is a 77-year-old male from Lincoln County. Our 21st 199th death is a 63-year-old male from Harrison County. And our 22nd 100th death in West Virginia is a 68-year-old male from Wood County. Like I said, 25 compared to where we were is better, but it's 25 great West Virginians, and it's 2,200 great West Virginians that we've lost in this great state. Our new positive cases are 467 in the last 24 hours. And get this, we haven't seen this in a while. Our daily percent positivity rate is at 3.17, and that's significantly less. Our cumulative positive numbers at 5.57, it's dropped a good little bit as well. Our active cases are at 13,103. That's 27 straight days that the active cases in West Virginia have gone down. Our recovered cases are 111,584. That's excellent. We have 348 hospitalized in the first day that we have been under 350 since November the 13th. We have 348 hospitalized. It's the first day since November the 13th that we've been under 350. We have 80 people that are in the ICU units. That's all better. And we only have one red county in West Virginia. And that's great. That is absolutely great. It would only be better if we could get rid of that one county. But if y'all could look at the map, look at all the green counties and all the yellow counties. Isn't it getting better and better and better? You know, still in the orange and still in the red, look where they are. It's pretty much all border counties. All border counties. Like I said, West Virginia doesn't have the blessing to be surrounded by an ocean. It's absolutely surrounded by population on all sides. And absolutely we need to try to do everything we continue to do in West Virginia, and it'll get better. We're seeing it all over the place. This week, we're right now at 98.3% administration rate for first doses and 84.5% on second doses. Our goal is always to get 100% in the arms, and we'll have up 100% because, you know, what we'll be doing over the weekend will put us at 100%, and we'll start again on Monday. And here we go again, you know, to absolutely lead the nation over and over. Yesterday we put 10,544 shots in West Virginians' arms, and to date we have put 354,063 of life-saving vaccine in people's arms. We continue to lead the nation because our partners at the local and community level and the county level are unbelievable. Great, great, great work, and great work by our National Guard. You know, all of our counties and our community partners play this vital role, and I just can't say enough about them. They have been great beyond belief. As far as leading the nation, West Virginia continues to lead the nation with more vaccine administration. We lead the nation in second-rate doses as well. A total of 6.81% of our entire population has been vaccinated, and we're leading the nation in that metric as well. As far as our vaccine scheduling system, you know, we really need to push registrations for people that are 65 years of age and older in these counties. Please pay close attention to me. We need to get more pre-registration out of Gilmer, Calhoun, Clay, Grant, Braxton, and Monroe counties. It's really important. I'm going to read it again. We need to get more registration in our pre-registration program. You know, we absolutely need that in Gilmer, Calhoun, Clay, Grant, Braxton, and Monroe counties. These counties are running behind our other counties. We need to get them registered. You know, since we opened it, we've now got over 240,000 registered West Virginians. And if you're still having trouble on how to do it and everything, you can call us and we'll help you get through the process, just like we've said over and over. This week, Saving Our Wisdom clinics that are all across our state and all 55 counties. Be sure to check updates due to weather conditions. Names are being pulled from the West Virginia COVID vaccine registration system to fill appointments, and wait lists and everything are now being exhausted, you know, through all the clinics and everything. I want to again encourage anyone above the age of 65 to call or go online to register through our online scheduling system. We do not have enough doses to go do everybody in the state of West Virginia, but we're continuing to push and push and push to get more and more and more doses out to all across our entire 55 counties. And get this number, and this number is one that I am super proud of, because really and truly these people felt like they were going to sit on the sidelines till April before they could possibly get vaccinated. So far, in West Virginia, we have vaccinated 121,000. 726 individuals 65 years of age and older, and 52,060 of them have been vaccinated and got their second shots. Unbelievable. The amount of lives we've saved there are probably countless almost. Again, with our Saving Our Wisdom Clinic Spotlight, I want to highlight a couple of local clinics that are important and a gigantic part of our Operation Saving Our Wisdom. Today, I am happy to announce that the Cabell Huntington Health Department, along with various community partners, is opening a COVID vaccine site in the old Sears building at the Huntington Mall. This will become the weekly vaccination site for Cabell County area, and once the vaccine supplies allow it, this site can administer up to 3,000 vaccines a day. This is a great example of our community partners and how we work together. And now I want to introduce Dr. Mike Kilkenny from the Cabell Huntington Health Department, and Mike will talk to us a little bit about all the good stuff that's going on there.
Thanks. First, I want to thank Dr. Amjad and Secretary Crouch, but especially thank you, Governor Justice, for the work that you've done to make this site available to us. We are really excited to be here in the old Sears building, set up, ready to start vaccinating next week. And our partners are very excited. We're partnered with the Cabell County EMS, with Marshall University, with Valley Health, with Mountain Health, and Marshall Health. And not all of those could join us this morning, but we do have the Mayor of Barbersville with us here today, Chris Tatum, who called your office and got your help, and we appreciate that. We have Dr. Larry Dial from Marshall Health and Mountain Health, and Dr. Kevin Yingling, who's the Chairman of the Board of Health for the Cabell Huntington Health Department. We're just really excited to have this great facility, which is scalable and will allow us to vaccinate from the amount of vaccine we have today to any amount that you can secure for the state of West Virginia and send down to us. So we're happy and excited to be here, and thank you for your help in making this happen.
No, thank you, Doc, and congratulations to all of you. I mean, that's great stuff. You know, I spent a lot of time there at Marshall and everything, and I've got many, many ties, and thanks, and honestly, thank a big part of my life to all the good stuff that happened right there in that community. So that's really good. Way to go, everybody. Also today, I've got another announcement. I want to highlight the work of the Kanawha Charleston Health Department and their Saving Our Wisdom Clinic that they hold each week at the Charleston Coliseum and Convention Center. And to date, this clinic has given out over 20,000 doses of vaccine. And we've got a video we want to play to you right now about all the great stuff that's going on within that clinic and everything and all the good work they're doing.
For many, the promise of a COVID-19 vaccine is the first sense of hope they've had in nearly a year.
I feel much safer now since I got the vaccination. Of course, I've already gotten the second one, so it's very good to know that you feel like you are protected. I am very happy with the way that the governor has handled the vaccination. I think he's doing a good job with it. And also Kanawha County, I don't know how the other counties are doing, but I think that Kanawha County is right up there with the top.
The vaccine clinics being held at the Charleston Coliseum and Convention Center have been extremely successful. The key to that success, making sure the right players are at the planning table.
So we've been working with the Emergency Ambulance Authority, the County Commission, the Sheriff's Office, the City of Charleston, We've been working with the emergency managers both from the city of Charleston and from the county, working with our 911 system, and of course internally at the Kanawha Charleston Health Department.
Those scheduled to receive the vaccine are given a time to arrive, and because of detailed planning, they're in and out quickly.
And it continues to get smoother each time that we do them. So their time that they're with us is very minimal, some less than 30 minutes from the time they come to the front door and did their 15-minute observation period, and they're leaving and exiting the facility.
Wheelchairs are available for those with mobility issues, and in-car vaccination options are also available. Overall, the effort from the state, the West Virginia National Guard, county, and city governments has paid off.
And so we've been able to work with the state to give them feedback on what worked well for our patients, what worked well for our scheduling, and we're working together so that as it continues to roll out, that it's going to be easier on the other counties as they stand up to do their clinics.
Vaccination clinics will continue to be held statewide, bringing more hope to those at the highest risk.
Well, listen, I just got to say this because some of the people I surely wouldn't maybe know their names, but Dr. Sherry Young, way to go. Way to go with all the great people of Kanawha County and all the work you're doing. I could not be more proud of you, and thanks so much. You know, you stepped up, and together we're getting a lot of good stuff done, so it's really great. Really proud of you. You know, our vaccine info line, if you'll pull that up and everything, y'all can see that and everything, and just reminders as we go forward and everything. All these vaccines that you're getting today require 2 doses. Don't forget to absolutely get your second dose, and always remember just this, that the real brass tacks facts, and I'll only just tell you the truth, I always will, and everything is that, you know, you cannot absolutely get COVID from taking the vaccine. You're not going to grow antlers. Absolutely, your best defense other than the vaccine is wearing the mask, and wearing the mask even after you get the vaccine. We're winning this now. We're winning this. Let's not slide back down the mountain. Remember your antibodies and everything that are available. If you feel the least bit sick and you are just unusual, and you'll go get a test, and if we were to find out that you're positive and we can get you these antibodies before things get really tough, we'll save your life, or the odds are we surely will. You know, as far as continuing to utilize our free testing, please do that. And the free testing map's up right there. Again, special thanks to all the drive-through pharmacy work that Walgreens and Frith has done, and that's really good. We really appreciate the vaccines that are coming into Walgreens across our state, the additional vaccines and the work that they're going to do there as well. We're down to 34 outbreaks in our long-term care facilities. It's amazing, amazing, amazing. That's really good. Get this one. I said it the other day, we have 1 active outbreak in our church community. It's amazing. Fayette County is the only place that we have an outbreak in our church community, and absolutely that just goes to just all the great work that's been done. Absolutely, keeping a pew in between you if you're going to church. Absolutely, you know, from the standpoint of wearing your mask and social distancing and washing your hands, it's all important stuff. You've done it, West Virginia. You've done it. You've saved a lot of lives along the way. Absolutely, I could never be more proud. At corrections, we have 53 inmate cases, 13 staff cases. You know, they have now confirmed 4 of those deaths as COVID related. One is a 71-year-old Mount Olive inmate who died on October the 1st. The rest are of St. Mary's inmates, a 63-year-old who died December 25th, a 78-year-old who died January 16th, and a 69-year-old who died January 20th. All were hospitalized when they died. All had underlying medical conditions. And this brings our total number of deaths in correction to 9. You know, it's 9 too many. We know that. but we know what this killer's all about. And if you look at other states and where they are, 9 is an amazingly good number. I tell you over and over about wearing your face mask, and I tell you over and over about if God has blessed you and blessed you in a way that you have recovered from this dreaded disease, go give blood. Go give blood. Really and truly, it's almost an obligation. So nevertheless, that's all I've got today. Proud of you, West Virginia. You're doing it.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and good afternoon. I wanted to touch on a few issues that the governor started to introduce, and I also want to congratulate Dr. Kilkenny at the Cabell Huntington Health Department for his great work, and certainly Dr. Sherry Young in the Kanawha Charleston Health Department for her great work. You know, we are seeing improvement in West Virginia as well as around the country. It is important, though, as the governor has really encouraged us, is to not become complacent. It is really the time that we need to continue to be very, very committed to wearing masks. The CDC, the Centers for Disease Control, are adding to their guidance to point out that double masking may be appropriate for people today. That's not the absolute recommendation, but we know that with these variant virus forms coming around, that having 2 masks, a 3-ply sort of surgical or disposable mask on the bottom, perhaps with a cloth mask on top, can help because of the fit across the face. The additional barrier protection of having double masking, or wear a cloth mask and pull a gaiter up, or even 2 cloth masks that fit over top of each other, just trying to improve that sort of the seal around your face. And it's really good to have one of the masks with a metal nose clip so you can secure that around your nose. The other issues are the CDC has also given additional guidance for people that have finished their immunizations. So if you are 2 weeks out after your second dose of either Moderna or Pfizer, and you become exposed to somebody who is diagnosed with COVID-19, you won't necessarily have to quarantine yourself, provided that you're at least 2 weeks out from your second vaccine, that you are within 3 months of your first vaccine, and that you don't have any symptoms. And if you don't quarantine, it's still important to wear your mask if you're out, but you need to track and make sure you don't develop any symptoms in that 2-week period of time. And if you do, you should get tested and then start to follow the usual quarantine procedures. It's really important as we go forward that we are paying a lot of attention to enjoying perhaps, an improvement in what we're seeing in additional capabilities in people that have finished their vaccinations and are fully 2 weeks out from their second vaccine, but also to be very, very careful, because at the end of the day, we want to make sure that we are protecting ourselves and protecting each other. And finally, what I would say is, as the governor said, we really want everybody to enroll in the Everbridge system. So please register so that we have a complete line accounting for each citizen in the state, so that we can make sure that when it's your turn to get vaccinated, and we're just so happy that so many of our citizens are choosing to be vaccinated, but when it's your turn to be vaccinated, we want to make sure that we can identify you and contact you so that you can get that vaccine. And we also want to have the system available so that you can continue to understand where you stand in line. So more vaccines coming, lots of good news at this point, but not a time to lower our commitment and our vigilance to make sure that we are continuing to protect ourselves and each other. So thank you so much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. As Governor pointed out and Clay pointed out, I want to also encourage West Virginians to register. Pre-registering helps us plan. And I want to highlight those counties again: Gilmer, Grant, Calhoun, Clay, Braxton, and Monroe. If you're a resident of one of those counties, or you're a leader in the community, a church leader, a community leader, encourage people to register. It helps us plan. As pointed out, it's really important to us. We will continue to improve our processes. This morning we had a call with the Hospital Association, and we're continuing to improve our efforts in communication with hospitals and the facilities that you saw, the mass sites. So as more vaccines come, we'll be prepared. As pointed out, the federal pharmacy program Friday, Saturday, and Sunday through Walgreens will be distributing and administering 7,300 vaccines. Next week, we believe we will be bringing on federally qualified health clinics under the federal plan. We're waiting for final information from the federal government on that. Our registration system, prediction by staff this morning was that by the 4th of March, we will have as many as 500,000 West Virginians registered in that system. So please continue to press those numbers up, move forward. Today, I also want to thank FEMA Region 3, Mary Ann Tierney, the administrator, Jeff Jones, who's our FEMA rep on the ground in West Virginia, has been with us through the 2016 flood response, is bringing in 25 additional FEMA reservists to support the Joint Interagency Task Force and help us with manpower. So we greatly appreciate that and the work that they're doing, and continue to integrate with us as is the most important thing that's going on. And then last thing, Governor, I'm going to use a point of personal privilege here and just talk about what great people we have in West Virginia, and talk about a good Samaritan by the name of Steve Masters from Morgantown. This morning, my wife lost her wallet, and instead of me having to spend a lot of time helping her and being able to stay focused on vaccines, a good Samaritan by the name of Steve Masters found that wallet, and within an hour had gotten it back to her. So Steve, thanks for your help today and allowing me to stay focused on vaccine distribution.
All right, thank you, sir. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. I want to first thank Dr. Mike Kilkenny and his team in Huntington. They are truly doing an outstanding job down there. Congratulations on the building and build out of the new vaccine clinic there. We're excited about that as well. And also to Dr. Sherry Young, who just does an outstanding job week after week. Both of these folks are leaders in their community and have been so since the testing phase of this through the vaccination phase. So thank you both. Unfortunately, DHHR has experienced another death due to COVID. Pam Holt was an employee with the Bureau of Children and Families, was our Human Resources Director, was also the Human Resources Director in the Bureau of Public Health. Has been with DHHR for 8 years, has been a public servant for the state of West Virginia for 17 years. Pam is survived by her husband, Eddie, of 52 years, and their sons, David and Joey, and her cherished grandson, Seth, all of whom she loved dearly and talked about constantly. So please join me in wishing their family sincere condolences. Thank you.
All right, thank you, Secretary. Dr. Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Thank you. Good afternoon, Governor and cabinet members. I'm curious, I got a call yesterday of someone who's very concerned about House Bill 2015, and the companion bill is Senate Bill 12. And essentially what my understanding is, it would allow the governor a greater authority on declaring a state of emergency to put the health department all under his jurisdiction. In other words, instead of having 55 county health departments manage a crisis like this, should we ever have one again, the state public health officer, Dr. Amjad, or whoever would hold that position, would make all the decisions and policies that would affect all 55 counties, rather than the current system we have here, where Dr. Sherry Young makes decisions for Kanawha County and Dr. Kilkenny makes decisions for Cabell County. Is the governor supporting this legislation, and is this a good idea? And I'd like some of the medical folks to weigh in, especially if Dr. Kilkenny is still there.
Well, Mark, from my standpoint, I would tell you that my staff is looking at it and everything. I think it's a little premature, for us to be able to voice an opinion, about the bill, but we're looking at it and we're all over it, and we'll give you input as we go forward. But I think right now it's a little premature.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if we could get a little bit more information on those inmate deaths. Why did it take so long to confirm that they were COVID related? You said one of those deaths was in October. And because of that lag, does that mean we're anticipating, confirming more of these? Thank you.
I think Secretary Crouch or Dr. Amjad, y'all have got to answer this. I don't know the answers to that.
I'll answer that, Governor. Most of those, Charles, we'd have to also defer to Larry Messina at the correctional facility, but a lot of those, it does take some time going through the Office of the Chief Medical Examiner, but those also will have to defer to Larry Messina at the correctional facility, but we don't anticipate getting more information, but those do take time going through the Chief Medical Examiner's office as well to confirm those. Thanks.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. A question about how people are being selected to get the vaccines, because I'm confused about it, and that it's the overriding and overarching subject of communications to me from people who are calling, who are emailing, dozens and dozens and dozens of people. So is it by age? Is it by comorbidity? Is it by when you decided to sign up? Is it by alphabetical order? Is it by county? Is it by hair color? I mean, what exactly is the criteria that's being used to pick people to get the vaccine? Because it appears to be, at least from the people that are calling me, on the surface, at best, random. I know that's not the case. So could you guys lay it out for us and tell us how you're proceeding? Thank you.
Kenny, I'm going to defer to General Hoyer because he knows this a whole lot better than I would know this and everything, the process and how we're going through all that and everything. But I got to say this, I love your Superman shirt. I mean, you're looking good there. You really are. And I'm not kidding you. You do look good. All right. General.
Governor, I always knew Kenny was Superman. But Kenny, on a serious note to your question, go back to what the governor's talked about before, age. But if you recall, Kenny, we had 4 principles that the governor established early on: reduce death rates, reduce hospitalizations, affect our most vulnerable population, and maintain critical services. We knew we had to early on, because of the percentage of deaths from nursing home residents and age, we had to get the nursing home residents as well as staff who were potentially bringing the virus in. We knew we had to get the healthcare workers who were critical to us keeping those services available to our older population and because of our health risks. But if you look at the numbers the governor talked about earlier, of 236,000 first doses, 121,000 of those have already gone to people over the age of 65. So we continue to stay focused on that. As far as how that data goes out, originally, before we established the pre-registration system, counties were maintaining lists based on the direction and the guidance that we were giving, and they were calling and still continue to call off those lists while we continue to merge everything into one focused registration process. As that moves forward, what we are doing now, for example, with the pharmacy program, we are pulling individuals off of those pre-registration list that meet those requirements, and then pushing that data to those 73 pharmacies that will administer 100 doses in each of the pharmacies. So continue to focus on age, but we also know we've got some populations that don't meet that age requirement that we have to stay focused on in order to maintain critical services such as our acute care hospitals and our nursing home facilities. Hopefully that helps with the explanation.
Just one second. And Kenny, of course, you know this, but of those 233,000 doses, if we've gotten in, and I don't know exactly what the number was right off. Let me see. 121,000 of the 232 have gone to people 65 years of age and older, and then if you break down the other 110,000, you've got to remember all the nursing homes, all the teachers. You know, then we went to the 80 plus, and all the acute care people, and you know, so there's been a real method to the chaos and everything that's gone about, and I give a tremendous amount of those accolades to all those experts that have been up there with you every day.
All right, thank you, Kenny. Next to June Leffler with West Virginia Public Broadcasting.
Hello, thank you for taking my question. This is coming by way of a colleague of mine. So let me pull it up. So in the last presser and in many previous pressers, the governor and the panel have said that it's really vital to get more vaccines out to the African American community. And you guys are partnering with the Partnership of African American Churches. So we know that is going on. You're working with those folks. I'm wondering if you're working with any other organizations, and namely, are you working with Marshall University's Minority Health Institute, seeing as they're one of our best universities and they're associated with the medical school? Thank you.
General, you go, please.
Governor, I believe Secretary Crouch may have the most information on this.
Yes, thank you, Governor. Thank you, Jim. We are contracting with the African American churches and Reverend Patterson. We're also looking at some other options right now. We have information that shows that 7,000, a little over 7,000 African Americans have been vaccinated at this point. That's about 2%. What's missing there is some data that is 13,000 individuals that we don't have race reported on. So we're working with the West Virginia Health Information Network to match records and try to get better numbers there. So, and for example, we show a population, the white population in West Virginia, which is about 96%. We're showing 92% of those individuals being vaccinated. So we've got to get the unknown numbers there. We're working hard to get that data. We're also looking at contracting with other folks to provide vaccination services for African Americans. We have a couple of proposals right now that we're looking at. So we're trying to focus on that and get as many individuals as we can vaccinated as quickly as we can. And we're looking at that by age as well. So thank you.
All right, thank you, June. Next, we'll go to Phil Cabell with the Charleston Gazette-Mail.
Hello, everyone. Yesterday, President Biden announced that the federal government is in the process of purchasing another 200 million doses of vaccine, which should allow 300 million Americans to be vaccinated, I believe he said by the end of July. Do we have any logistics on distribution to West Virginia?
General Hoyer, you would maybe know this better than I.
Yeah, Phil, at this time, we don't have any specifics yet from CDC or Operation Warp Speed on when and how those will be distributed. But what we are focused on right now is continuing to improve our distribution process to be prepared. And as we've talked about before, we would like right now a minimum of 125,000 a week in order to move forward as quickly as we need to in West Virginia, and we'll continue to prepare our network to receive all that we can get.
All right, thanks, Phil. Next is Junaid Dill with the AP.
Hey there, yeah, it's Junaid with the Associated Press. I was wondering, does the state know yet if it's expecting a big boost in vaccine allocation? Some places are reporting that they're going to see a good jump in allocation next week. Are we still expecting something around 30,000 doses, or is that going to go up anytime soon? Is there any indication of when the allocation could really go up? Thanks.
Let me lead off and just say this, that, on the call, the last call that I was on, which was, I guess, last week, but the call that we were on, we were indicated at that time, and in general, I could be wrong in this and everything, but I think that we were looking at an increase of somewhere around 20%, and then in addition to that, we were looking at the allocation of the 1 million doses that was going to all the farms, pharmacies throughout the land and everything, and that's our 7,800 doses or 7,000 doses or 6,800. I don't know exactly which one it was, but nevertheless, General, if you could step in there, please.
Yes, Governor, as you described, that is what we're being told. We do not have final numbers yet related to that. We do know that we will continue to get the 7,300 doses under the federal pharmacy program. And we were also informed that we will get some additional doses for the federally qualified health clinics. But as of when this press conference started, we do not have the final numbers yet on what we will be receiving.
Back to me just one second. Let me mention one other thing. And, if you're happening to watch the national news and everything, we are expecting a big bump in the relatively near future in the Pfizer production. We're still probably just a very, very short period away from the Johnson & Johnson, vaccine. And with all that being said, I really do believe that there's going to be a day coming in the near future when the vaccines will be so abundant that we can really, really, really make a dent in moving forward to get everybody in the state vaccinated, especially all the people over 65 right off the get-go.
All right, thanks, Junaid. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Most of us wear the Kenny shirt underneath our dress clothes, so there you go. I have a question about schools. I know that we had a period of time after Christmas, after Thanksgiving, where we had a window there that we were kind of concerned about. There could be spread or not spread. Schools went back on January 19th. Are we getting to the end of that window when we would potentially see something happen if it was going to happen?
Dr. Marsh, this is you, sir.
Thank you, Paul, for the questions. Certainly, we continue to track closely all outbreaks that happen in schools and particularly looking for any evidence of in-classroom spread. We really are not seeing that, and much as the rest of the state and the rest of the country is seeing that a lot of the measures of transmission are starting to go down. The death rate nationally is starting to go down. Certainly, we've seen that in West Virginia as well. So we would have anticipated that given the December holidays and the new year, that we would have seen the maximum impact of that already from the standpoint of hospitalizations, and we're not seeing that at all. And as we look at schools coming back in, it's about a 2 to 4 week interval, but we track this metric, these schools, every single day, and we're not seeing that activity. So I think it's all good news as long as people are really good and committed to wearing masks and staying physically distanced and maintaining all those good sort of stay home if you're sick, wash your hands, those approaches, then in classroom teaching is very safe.
All right, thanks, Paul. Governor, I'll turn it back to you.
Well, again, thank you, everybody. I remind everybody just this, that the mountain is always the steepest at the top. Just think about what I just said. I said this in my State of the State. It's just fact. Anytime you've been walking around in the mountains of West Virginia, when you're down, in the foothills, it's relatively gradual, and then all of a sudden you keep going up and up and up, and then you're almost there, aren't you? You're almost there. And you look, and it is just flat, almost straight up for you to get to the top of the mountain and cross over. Well, West Virginia is really making progress, and I don't know where we are on the climbing of the mountain exactly, but I know we've made real progress. And I know that absolutely most people that are climbing mountains in their lives come to the steepest part and then slide back down. Most people don't get across. We can, West Virginia, get across. But what I mean by all of this is just one thing and one thing alone. It's no time to drop your guard. It's no time to celebrate yet. You're not across the mountain. You can slide back down. And so really, really, right now, be on guard. Absolutely do all the things that these great health experts are telling you each and every day. Dig in our heels and pull the rope together. That's the important stuff. Absolutely, we can get there, but we're not there right now. Still be a little bit on guard. Still be a little bit concerned, if not a lot concerned. And be prayerful for all the people that we've lost. And I'd like to one more time, even though we've said it a bunch of times, for those of you in Gilmer County, Calhoun County, Clay County, Grant County, Braxton County, and Monroe County, you are behind as far as the pre-registration that we have right up in front of you. Get yourself pre-registered where we can facilitate and make it easier to get you your vaccines. We'll continue to work night and day in getting more and more vaccines in West Virginia. We're pulling it off, West Virginia. You're leading the nation. You're absolutely the diamond in the rough that everybody missed. Keep doing it. Stay on guard, and we'll get up that steep part of that mountain. We can get there, West Virginia.